Welcome back to Why We Nurse. I'm your host, Serena Tobar, and today we are talking about one of the most exciting and nerve wracking moments in a nurse's journey, the first clinical experience. Joining me is Crondelette Scott, a nursing student who just stepped into the hospital for the very first time as part of their clinical rotation. We'll talk about what it felt like, what surprised them, and what they've learned so far. Crondelette, welcome to Why We Nurse. Tell us a little about yourself, what inspired you to pursue nursing, and what stage of your program you're in right now.
So, hello, and thank you for having me. I am Crondelette Scott. I'm a second year nursing student. This is actually my second degree. My career did not start off in nursing, but I had I've always wanted to pursue nursing and it just didn't work out. Like the time just was not right for various reasons. And I remember that my aunt she's actually a great aunt, but she was a lot younger to be a great aunt. So she's my grandmother's sister. And I remember her having episodes of like passing out in the kitchen, like before she just recently passed, like literally a couple months before I started nursing school. And I just remember her passing out. And I felt like if I would have known then what I know now, I probably could have helped her, a little bit more. And even though like my dream to become a nurse had always been there, that just kind of pushed me a little bit more. And I know that she would be very proud of me to see that I have actually taken the steps to move forward with it and I'm not letting anything stand in my way. I don't know if I said this, but I am a second year nursing student and I just started my first clinical rotation on yesterday. So it's great.
All right. So let's dive into that first day. What was going through your mind as you walked into the hospital in your scrubs for the first time?
It was a mix of excitement and I was nervous because I didn't know what to expect. I didn't know what I didn't know. Even some of the things that, I've learned and the skills that I practiced, I was like, oh my gosh, am I going to know this? Is this going to happen? So I was wondering, what am I going to see when I come in here? What is it going to be like? Am I going to be as compassionate as I think that I am for the patients? So it's a lot. It was an adrenaline rush. I was really tired, but the excitement kind of kept me going.
That's exciting. I remember my first clinical, it was kind of the same feelings many, many, many minutes ago. So let's talk about what kind of unit were you assigned to and what kind of patients did you see?
So we were in a rehabilitation unit. I'm not sure. I think it wasn't acute care. I don't remember the name, but we had four patients and we actually gained a fifth patient like by the end of the evening. So a lot of the patients that we had, they were coming from surgery or had just had a stroke. So they were trying to learn their ADLs again. And so I think I had like two patients that had recent strokes. Well, actually, I had the third one. I had three patients that had a recent stroke. We had patients that they were all fall risk. So I had two patients that had fall risk. And then I had, out of those two patients, both of them had a surgery and they were there to recover.
Was it what you expected or was it something completely different?
It was a mixture of both. So it wasn't really what I expected because it's kind of hard to explain. It was kind of fast paced, but not fast paced. So in my mind, I thought that I was going to go in there and I thought that at one point I thought it was going to be like continuously busy, but then I thought like, okay, you only have four patients. Like you're going to have time to sit down and rest and, do things and you really don't. So by the time that you finish going in administering medication, which I didn't administer medication yesterday, but after the nurses get there and you start administering medications and you do your rounds to check on your patients, then it's time to administer like a second round of medication and it's time to do something else. And you have to remember to make sure that you chart, which you should always chart afterwards and not wait till the last minute to do it. But you really don't have that time. I didn't have the time that I thought that I would have to like, okay, let me just sit down and kind of, I guess, necessarily process something, or I thought it was going to be like some dry time, like to where it's like, okay, I'm just sitting here not doing anything. There's always something to do. And so that was one of the things that I didn't necessarily expect out of my first day. But I mean, it was fun above all, though, because I met very nice people, very, very nice people. I loved all of my patients.
Can you share a moment that really stood out during that first shift?
I would have to say, I don't know if it's like a specific moment, but it I think I realized like seeing people like that, as nurses, you have to be compassionate. Even going into the nursing field, you have to be a compassionate person. You got to care about other people. And it made me just really look at people and be like, you can't really judge a person. You don't know what this person is going through and you don't know what their family is going through. So while you have a patient there, their family member is sitting there and they are really pouring out their heart to you. I learned to listen. There were times where the patient was one of the patients, she was just talking and expressing things that she had gone through in her life. And while the nurse that I was assigned to, she was going through like her health, her prior history, her health assessment. And sometimes you got to stop and take a break. You have to stop and take a break to listen to them because sometimes they'll answer all of your questions without you having to ask. And you can go through and you have to remember to not just be doing things to check a box, but sometimes they want people to relate to. So those were some of the things that kind of stood out to me on my shift is it just made me a little bit more compassionate and understanding of people's situation.
Clinical rotations can be very overwhelming. What's been the hardest part so far for you?
Would say even though like I haven't fully made it to the medication part of it, but it's a couple of things. The first thing was when I was in the hospital, understanding like how they do like the medication process and how they're pulling their medication, or how do you know how do you chart properly based off of the facility, because each facility has different protocols, and this facility had different protocols. Like for instance, on Sundays they take pictures of pressure ulcers or their integrity, and those are a few things that I would like to have understood more. But when you have clinical rotations, but you're also balancing classes as well, that can be a bit overwhelming. Even though the clinical rotations are one day a week, and it's also the long shift. So if you're not used to working a 12-hour shift, or moving around or being up on your feet for 12 hours, that can be something that can be a little bit challenging. Recommend having very, very comfortable shoes and making sure you have on compression socks.
Definitely compression socks. I tell everybody 12 hours on your feet, get some compression socks. Your back's going to thank you. Later on down the line, your legs are going to thank you when you don't have those ugly varicose veins.
Yep.
So you'll be thanking me when I say compression socks for sure. What skills or habits do you feel like you're already starting to build from your first shift?
Well, I think being compassionate is a skill. So I think that yesterday I did a head to toe assessment on an actual. Well, we did it on humans before, but an actual patient. I think that help learning how to do that, learning how to be more focused in what it is they're there for, opposed to just asking questions that we know that are not necessary to them. Even though my patient was very kind and he was very funny, I may not have a patient that's always like that. You know what I mean? I didn't realize how much I did learn yesterday, because I thought I was like, okay, I didn't really get to do anything. But when I sat down and I started writing out all the stuff that I did, I was like, oh, I did this, I did that. So I did the head to toe assessment. I was able to actually also take someone's heart and listen to that. I was actually able to take someone's vitals for them on the actual machine that they use. I asked to do that. I actually saw pressure ulcers. I was able to observe pitting edema, which we see that they teach us about that in school. But to actually see it and to see what it looks like in person, I thought it was kind of cool. Listening skills also, because you have to be able to listen to the patient, because one of my patients had a stroke and she had slurred speech. So she couldn't, you have to really listen to her so that you can understand what she's saying. And you don't want to repeat things back to them too much because they'll get frustrated. So active listening skills was a really, really big thing for me.
Not just something they tell you, it's something you really have to use, right?
Really have to use it. You have to use it because you can miss something. And just imagine you're asking someone a question over and over and over again, and they're like, I answered you the first 5 times. People get frustrated. Just imagine how you would feel, or if it was your family member and you're in a situation, you're not feeling the best, and then you have someone asking you the same question that you already answered just because they were not listening.
And then I heard you talk about your head to toe assessment. Yes. Students they love to make scripts for all their little things. So for all their little checkoffs, they like to make their little scripts. And then you get to the real person, and the real person doesn't know your script. So they don't stay on script. And that always throws students. And you can always see that look on their face like, that's not what you were supposed to say.
Yeah, you're not supposed to say that. Go with it.
So did you kind of have that moment, or were
I
you prepared?
So I'm not a script writer, so I didn't really write my script, but in my mind, I knew the way that it was supposed to go. And my patient was like not like he was not on script at all. Uh, he was not on script. He was very fun, but he absolutely was not on script. So I did get that, and I was just like, okay, let me go here now. Let me do this. But It was fun though, but it's a learning lesson too because you have to also be prepared. And that's one of the ways to make sure like you know and you're not just memorizing a script, but you actually have to know what you're doing. And one of the things that when we would do it in lab, we would have to talk through everything, and be like, okay, you have to do this. All right, I'm getting ready to do this. And so now you still would essentially talk through it, but some of the things you're not going to say, you're going to observe like on a real patient because the patient's going to be like, why are you saying this? Why are you telling me that? So, but it was different and it wasn't what I expected. I was super nervous, but it was not what I expected at all. At all.
So let's talk about your nerves. Did you have moments where you felt really nervous, and how did you handle your nerves or any moments of uncertainty?
I asked a lot of questions and I did have my biggest nervous moment was the head to toe assessment. And I don't know why I felt so nervous because it was times when it's kind of like when you have memory and like I know this stuff. I know how to do it. I've done it a million times. But when you're like, okay, this is the real deal. I don't know this person and this person doesn't know me. So I'm not doing it on my lab partner. And I think that I got on track and pushed through just because my patient he was very nice and he was really sweet and he kind of laughed about it and he was kind hearted and he was nervous too. So he was nervous too, but I think I just kind of pushed through it because I'm just that type of person. Even if I'm nervous about something, I have to remember to slow myself down and just to slow down and be like, okay, you know how to do this, you got this, and just to keep pushing through it. So I would say that that was my biggest nervous moment. And it's weird because that is probably like the least thing that I should have been nervous about, but everything else I was really excited about. It was also one of the things that I remember is that one of my professors told me that if you like when you have to go and you have to look at a patient or you have to see their, expose them, it's only awkward if you make it awkward. And so I kept that in the back of my mind because patients are vulnerable. You're seeing their body, you're seeing a side of them that you wouldn't see on a normal basis. So I didn't know how the patients will react to that or me having to, help someone who has to actually go to the restroom and how they will feel about that. But I didn't make it awkward and neither did they. So I would say that that was another thing that made me nervous a little bit too because you don't really know. You know what I mean?
Yeah.
I hope that makes sense.
No, that makes sense. Yeah. It's different. You see people in a very intimate way.
Yes.
And it's not something that you on the daily um do for strangers.
Right.
So yeah, that can be very awkward at first. And I remember that was kind of one of the things that was a little awkward for me as well. As some of my very first clinical experiences were with hygiene and catheterizations and stuff, very very intimate kind of areas where I was very naive in those areas.
You don't normally think that because we've talked about it in class and stuff like that, but you don't think that it's gonna be like that. And then you see people in their most vulnerable state and you're like, okay. And then it's also you have to remember like you're gonna have it was one situation you're gonna have people that have it's gonna be different smells there and you have to be able to be compassionate and understanding and you can't and sit there and make a face or be like, ugh, you have to be able to put your poker face on and be able to control that because people are very, very vulnerable at that time. You don't want to make anybody feel uncomfortable. You don't want to hurt anybody's feelings or anything like that. It could be you, and that's how I look at things like, hey, don't judge anybody because it can be you or it could be your family member. And how would you over there? So
Exactly. So, how has this experience changed how you see nursing compared to what you learned in class?
So I would have to honestly say that a lot of the things that I'm learning in school actually aligned with what I saw in the clinical. It's just in the clinical experience, but it's just actually being there and actually seeing it, and actually experiencing it. But most of the stuff really, really aligned. It was the compassion part that I think was the most impactful to me because I'm a compassionate person just in general. And just to see people in their vulnerable state, it made me even more compassionate. I'm like, okay, I understand. I understand that these people, I saw people, a man's wife, like, hey, I've been taking care of him for 45 years and she's in tears every time she's talking. And it's not that he is getting ready to kick the bucket. It's just because she's stressed and she's overwhelmed. And I saw a patient where she's an older lady and she was depressed. She didn't have anybody there to visit her. No one came up there. No one, was coming to see her. And she didn't want to eat. She didn't want to take any meds. She didn't want to do anything. And I was able to identify that immediately. And then I have someone that is like, hey, I never had any issues with diabetes. And we're like, dude, come on now. You had issues with diabetes. And then he comes back later and says, hey, yeah, I guess I kind of have had some issues with diabetes. So you get different people from different walks of life, but it's compassion. Compassion is a really, really, really big deal. Like it's a really big thing. But all the patients that I had yesterday, they were very, very kind and loving. And I know that it's not going to always be that way, but I loved every single patient that I had yesterday. It was so awesome. It was a very great experience.
That's wonderful to hear. If you could give one piece of advice to another student who's about to start their first clinical, what would it be?
Arrive on time because it's one of the things that we were told was to arrive at a certain time and then they give handoff report. Another thing I would say, and this is probably more so like not on the actual experience side, but I would say ask a lot of questions. If you have a question about something that's going on, ask the questions because this is a time for you to learn. Don't be ashamed about asking questions. That's what you're there for. That's what the nurses are there for, to answer your questions real time. That will be a very, very big thing because there were some things that the nurses there were super nice. They were great. They were absolutely great. They didn't make us feel uncomfortable. They didn't make us feel like we weren't wanted. But every time my nurse got up and moved, I moved with her until she had to tell me, hey, I got to go to lunch. And I'm like, okay. But, ask questions. That is the biggest thing. That's how you're going to learn. And if you don't ask questions or ask to say, hey, I know how to do this skill. Can I do this? Because it wasn't a lot like there, they had everything structured very well. So when it was time to do vitals, they have this, it was a CNA there. She was super awesome. When I tell you this girl was like superwoman, she was like superwoman and she was doing it all. And so I was able to help lift the patient. So help with mobility, help with the patient to the restroom. And then when we got time to do vitals, I asked her, I said, hey, can I try to do the vitals? Can I do the vitals? So I was able to do that. So ask questions. And if there's something that you know how to do, ask them, say, hey, is it okay if I do this because I know how to do it? They can only tell you yes or no. So,
Very good. What do you wish you would have known before walking into your clinical?
that the 12-hour shift was going to be very, very long. That's something I would have probably, I don't know, there's not necessarily a way to prepare for that. I'm used to working 8 hours. So there's not necessarily a way to prepare for that. But I would think for me, that was the biggest thing. I feel like I was pretty prepared. I had all my documents printed out. I had everything that I felt like I needed, but I think I was a little bit nervous just because I didn't know what to expect. So if we would have had like a debriefing on just a possibility of what to expect. I mean, it's not necessarily a way that you can just say, hey, this is what you're going to expect today, or this is what you're going to be dealing with today. Just to the best of of our ability or what we can know is just kind of have an oversight of what it would look like on first day of clinicals, kind of like what we're doing now. So hopefully it'll reach someone and it'll be helpful to someone to say, hey, this is what my experience was.
Do you have any tips for balancing confidence and humility as a learner?
I would say that if you're the smartest person in the room, you're really not the smartest person in the room. You have to it's nothing wrong with being confident about things, but you still have to ask questions. You're never the smartest person in the room. There's always an opportunity to learn even if you think that you know something. There was a couple of things in there that I thought I knew and I wasn't wrong, but there is also, layers to different things and knowing different things. So I would say it's okay to say, hey, I know how to do this. Like, for instance, with the head to toe assessment, hey, I know how to do this head to toe assessment. But if someone is giving you direction and they're saying, hey, try it this way, be open minded to that. Always, these nurses and your clinical instructors and your professors, they know more than you. We don't know anything. They know more than us. So we have to take everything that we can and learn from it. And that will be, I would say that's how I will balance it. I always remember that I'm not the smartest person in the room, and I always can learn something from someone.
And I think that that is really great advice to say, I'm not the smartest person in the room. You're not the smartest person in the room, because I can be the expert in one thing, but not the expert in something else.
Yep.
I've been a nurse for 25 years. I know a lot, but I don't know everything. And so I am, by background, am a med-surg tele or home health nurse. Those are the two areas that I've worked the most in. If you were to put me in the CVICU, I might have a little trouble because I have never used any of those machines before. So I would definitely need some orientation. I would have a lot of questions. I ask questions every day, even as an educator, when we're doing professional development. stuff. There's lots of questions, okay, because we want to be very, very clear. If we are going to be trying to explain something to somebody else, or we're going to tell somebody this is how you use this, or this is how we'll do this, or here's our new process, we ourselves want to be very, very, very clear exactly what it is.
And it's also okay to not know something. I think a lot of people are afraid to not know things or to say, I don't know. And there's nothing wrong with that. It is okay to not know because you're there to learn. Even as a nurse, once you get your nurse's license, it's okay to say, I don't know. I would rather tell someone I don't know than to go and make a mistake, you know, and to find out how to do it. But it's okay to not know. And I think that sometimes people may struggle with, saying, hey, I don't know. I really don't know how to do that. Could you please
Mhm.
help?
Yes, and that's one of the things we tell all of our staff in orientation is it is okay to not know something. It is not okay to not find out the
That part.
answer. So the fake it till you make it is not, that's not what we want. We
No.
want, it's okay to say, and it's even okay to tell a patient, you know what, I don't know the answer to that, but I'm going to find out and I'm going to follow back up with you. I'm going to come back and get you that answer.
Yep. I agree.
Chronolette, thank you for sharing your story. Your experience reminds us that nursing is a journey and every step matters. To all students listening, your first clinical isn't about perfection. It's about learning, growing, and finding your why. Follow at Why We Nurse on Facebook and Instagram for updates and behind the scenes content. Got a story to share or want to be a guest? Email me at whywenursepodcast@gmail.com. Until next time, stay strong, stay compassionate, and remember why you nurse.